So, Dr. Fauci, there's a bit of a debate going on right now on whether a fourth wave is appearing. There are really bright people on both sides that are debating that right now. I know nobody has the ultimate answer. What are you looking at right now in the numbers? Does it seem like a fourth wave is coming?
You know, certainly there are upticks in cases, Joe, in multiple states. That's for sure. You know, we had the big peak over the winter, over the Christmas and New Year's holiday. It came back down. And then instead of going all the way down, it plateaued at a really unacceptably high level. It was around 30, 40,000 cases per day. But then over the last few weeks, it's creeped up to 50, 55, and then 60,000 cases a day. So what's happening is that there clearly is an increase. The difference factor that's going on right now that were different from the surges that we saw last year is that we have a highly efficacious vaccine now. And every day, at least 3 to 4 million people get vaccinated. We have well over 50, 60 million people who are vaccinated completely, about 100 million who are vaccinated at least partially. And every day it gets better and better. So we're looking at kind of a race between the vaccine, which is highly efficacious, and a real, I don't want to say surge, because surge means you get a really high increase. We're seeing it start to creep up now. So the real question is the efficacy of the vaccine going to prevent that from going up the way we saw it in previous surges? I hope not. I don't think so, because as long as we keep vaccinating people efficiently and effectively, I don't think that's going to happen. That doesn't mean that we're not going to still seeing increases in cases. Whether it explodes into a real surge or not remains to be seen. I think that the vaccine is going to prevent that from happening. But, you know, the other wild card in this, Joe, is that even though everybody has COVID-19 fatigue and wants to get back to normality, you know, you see the pictures of the Texas Rangers Stadium essentially crowded. We don't want to declare victory prematurely, because we have a virus out there now, this variant that spreads really quite efficiently. And if you pull back on masking and avoiding congregate setting, you're really taking a pretty big risk. If we can just hang in there a bit longer, because every day that we hang in there and not just give in to getting away from all restrictions, every day we do better and better, because 3 to 4 million people get vaccinated.
I was going to ask you about how things are different now than over the past year. When you're looking at the numbers in the past, if you saw hospitalizations down, if you saw deaths down, but infections going up, infections were always a leading indicator of what was coming in, 7 to 10 days, 14 days perhaps. How much has that changed, not just because of the vaccine, but also because the viral load may be less now than it was at the beginning when people had COVID, because we understand what causes COVID, have a better understanding today than we did back last March. How much of that comes into play? So when you see the cases start to go up, it doesn't naturally mean that, I'm not trying to be Pollyanna here, I'm just saying, looking at the science, looking at medicine, it doesn't mean that a surge in deaths and a surge in hospitalizations are going to automatically follow that surge in infections.
Well, yes to everything you said, but one other factor that we really need to mention, Joe, is that right now more than 75% of people over 65 years of age have received at least one shot of a 2-shot vaccine, which means that when people get infected now, it's more of the younger group who, although they can get seriously ill and they can get hospitalized, they're less of a risk of a severe outcome requiring hospitalization and even leading to death than the elderly individuals. So one of the good things is that we prioritized with the vaccinations people who are elderly. And for the most part, relatively speaking, they are more protected now than the younger people. In time, younger people will be equally as protected. So what you're saying is absolutely correct. We're seeing infections now, but the age range is skewed much more towards younger people. And although they can get seriously ill, the overall rate of hospitalizations in them is less than if you were an elderly person.
Dr. Fauci, it's Willie Geist. Great to have you back on the show this morning, particularly talking some baseball. I want to say that I got my first shot of the vaccine yesterday. I feel great. Mild soreness in my arm, but it feels good. I'll go back in 4 weeks for my second dose. And my wife and I, who went together yesterday up in Suffern, New York, felt nothing but gratitude for the doctors and the scientists and the public health officials like yourself who brought us to this day. So I know I speak for a lot of people in this country when I say that. With that said, you mentioned Texas and that full ballpark in Arlington yesterday. There was a lot of concern last month when Texas effectively opened up, dropped all those restrictions and said it's back to life. And if you go to Texas, as you know, it looks like 2019. The restaurants and the bars are full and open. The ballparks are full. And yet we've seen cases and hospitalizations since then continue to tick downward. So what do you make of that as all of us look around and sort of try to consider how safe it is to get back to normal life?
Yeah, you know, it can be confusing because you may see a lag and a delay, because often you have to wait a few weeks before you see the effect of what you're doing right now. You know, there are a lot of things that go into that. I mean, when you say that they've had a lot of activity on the outside, like ball games, I'm not really quite sure. It could be they're doing things outdoors. You know, it's very difficult to just one-on-one compare that. You just have to see in the long range. I hope they continue to tick down. If they do, that would be great. But there's always the concern when you pull back on methods, particularly things like indoor dining and bars that are crowded, you can see a delay and then all of a sudden tick right back up. We've been fooled before by situations where people begin to open up, nothing happens, and then all of a sudden, several weeks later, things start exploding on you. So we got to be careful we don't prematurely judge that.
You've been pretty clear over the last few months, Dr. Fauci, and so too as CDC Director Dr. Rachel Walensky, about schools, that they should be opened as long as it can be done safely with some of the mitigation in place. Mass distancing, which the CDC brought down from 6 feet to 3 feet a few weeks ago, and yet so many schools across the country remain closed. As we sit here now in April, a full year since school closed, and a lot of students have lost contact with their schools over that time. Where are you right now? Should schools be open in this country?
Yeah, I think we should try as best as we can to get them open and keep them open. Follow the CDC guidelines, but I certainly lean much more towards let's getting them open as quickly as we possibly can. You want to follow the CDC guidelines, but let's just do it in a manner in which that we look at the big picture. I mean, I feel the same way. We talk about this all the time, that you want to balance with the negative effect of keeping kids out of school with the potential effect of illness of keeping them, out of school and in school. You have to really be careful. There's a delicate balance there that we have to continue to evaluate over time. It's very important. You want the kids in school, but you want them to be safe. Some really good news, and this is important, is that a recent study showed that kids from 12 to 15 years old were vaccinated. The vaccine was 100% effective in protecting them from clinically irrelevant disease. That's going to be huge because high school kids are the ones you're most concerned about spreading. And another thing about schools, one of the real important pockets of spread have been in team sports as opposed to kids in the classroom. So when you bring people back to school, you might want to consider the relative risk of participating in sports which seem to be a driver of infection as opposed to a child sitting in a classroom learning.
The AP's Jonathan Lemire is with us and has a question, Dr. Fauci.
Dr. Fauci, good morning. Great to see you again. I know there's a lot of concern over the weekend with the report that 15 million vaccine doses were ruined at a manufacturing facility, but yet overall vaccine supply in the nation seems to be surging. The president, we're reporting, is going to announce today that he'll have hit 150 million doses since Inauguration Day, and that he is moving up the deadline for all states to make all adults eligible for the vaccine up to April 19th, which is just right around the corner. So while there is a lot of vaccine out there, my question to you is, there's also real pockets of resistance we're seeing across the country of people refusing to take it. What do you think can be done there? Because, of course, there can't be true herd immunity, true safety, if there are so many Americans who won't take the vaccine.
Yeah, that's a real problem and really quite disturbing, particularly given the fact that the vaccines are so highly efficacious. And when you look in the real-time, real-world effectiveness, they maintain their efficacy and they're highly effective in the community. What we're doing is we're trying to get trusted messengers, people who in the community are trusted, and those believe them when they talk about the importance of getting vaccine. We started last week a COVID-19 community core, in which a group of trusted messengers, they could be clergy, sports figures, entertainers, are given information from the CDC to be able to spread that information effectively about why people should be getting vaccinated. So you're exactly on the money. It's very frustrating, but we really have got to get more and more people vaccinated. We have the vaccine supply. We have the vaccinators. We've just got to get as many people as we possibly can who have some degree of hesitancy to get them to turn the corner with us and get vaccinated.
All right, Dr. Anthony Fauci, American hero and New York Yankee fan, a riddle wrapped in an enigma, wrapped in a mystery. Thank you so much. Thank you so much for being with us. We greatly appreciate your time. We'll talk to you soon. Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.